السلام عليكم.
عليكم السلام.
عليكم السلام.
How are you guys?
الحمد لله.
Okay, today inshallah we will practice some stations for history taking. Who approach? We have three approaches: Socrates, Odebara, and who approach. So to pass with very high score, you have to make papers for history taking category, psychiatry toxicology category. So both of them history taking. Same approach with a small modification. General approach for resus, general approach for procedures and teaching, general approach for examination, general approach for communication skills station. You have 5 domains. Accuracy means the general approach is the checklist. Skillfulness should be fluent. Efficiency structure should be organized. Supportiveness, good eye contact, rapport, empathy, sympathy, check comfortability, check pain, check symptoms. If the patient has symptoms, we should address symptoms before proceed. And questions or information in pieces and the pause between pieces. Safety, correct information, including differential diagnosis, decisions. General approach of history, you have introduction, then 3 open questions, then the part 2. So part 1, then part 2. Okay. You can fix this in any history, whatever adult or pediatric or psychiatry or toxicology. So today we will use who approach. We can use who approach in few stations, not all stations. So if the patient has episode of fall or loss of consciousness, I mean syncope, or fits, I mean jerk movements, or any abnormal behavior, whatever the patient confused, unconscious, so any decreased conscious level, you can use who approach. Of course, you will take data from the patient if he is alert, I mean just as 15, but he was confused, but now he's conscious. Okay. What if the patient has hypoglycemia? How we will take history from the patient himself? Okay. If you find 2 actors inside the room, don't take history from the relative. You want to take history from the relative. If you manage the patient and still unconscious, for example, the patient has hypoglycemia. You ask the nurse, you don't have nurse in the room. We are acting. We are just pretending. Please, nurse, insert the 2 IV access and give dextrose, 10%, 200 ml. The patient is still acting as unconscious. In such a case, you should take data from the relay. But once you say give the patient dextrose and the patient is conscious, here you can take data from the patient. Anyway, they will mention in the scenario, take data or take history from the patient. So if they said from the patient, means from the patient, not from the relative, not collateral history. Okay. Okay. Here in who approach, one slide only with review of systems. So it's a very short. The diagnosis and the management plan will be the same. Regarding Socrates, we finished already, and Odebara we finished. Here, who approach one slide only, so it's a very short. Okay, guys? So please follow the same questions, same arrangement. So you will ask 5 questions of who approach. Then divide the approach into three parts: before, during, after. Then review of systems here, it will be very concise because already you ask CNS, already you ask cardiovascular. Okay, so you will ask these brief questions. Okay, so what are the questions of who approach? Who saw the event? So after introduction, rapport, empathy, sympathy, after everything, after check comfortability, pain, then ask who saw the event? When did it happen? Where did it happen? Why do you think is the reason behind that? How many times in the past? Then before this event, what was you doing? Okay. Um, Before the event, any headache or vision, it changes before the event. Any heart racing or chest pain before the event. Vasovagal, any cough or sneeze before the event. Okay. Orthostatic, did that happen after standing? So you will ask at least CNS and the cardiovascular, the most important symptoms. Okay. During, you can say, during this event, did you bite your tongue? Did you wet yourself? Any jerk movements? After the event, did you lose your consciousness? How long did it take to recover? Did you recover fully? If the patient did not lose consciousness, of course, not logic to say how long did it take to recover and did you recover fully? Of course, not logic. Okay. If the patient has jerk movements, most likely he lost the consciousness, but you have to confirm. Okay. Then review of systems, very, very concise. Any numbness, any weakness after the event, any injury, any shortness of breath, any temperature, any night sweats, any change in appetite or weight, any change in urine, any change in bowel habit, more than enough. So you have part one, general approach, part one, then who approach, then general approach, part two. Clear until now, guys?
Yes.
Okay. So we have for practice today, Omar, Jivana, Kalyan, Ahmed, Basamat, Asma. If anyone interested to practice, you can raise your hand, please. So the first station, fall, then we will use syncope or collapse. Okay. It could be heart problem, it could be brain problem, it could be pregnancy. How to know it's a heart problem if the patient lost consciousness? Few seconds, is it heart or brain, guys?
Heart.
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 So
Heart.
any patient lost consciousness for few seconds and now he is normal. What is the definition of syncope? Loss of consciousness with a spontaneous regain of consciousness. Spontaneous. He did not do anything. No one helped him. So he lost consciousness few seconds and normal again. So this is called syncope. So a few seconds, it means heart. If 5 or 10 minutes,
Brain.
it could
Brain.
Brain.
it could be brain until proven otherwise. If the patient fell on his face, is it heart or brain?
Brain.
Heart.
Heart.
If the patient fell on his face, it could be heart. If the patient fell on his back,
Brain.
it could be brain. If the patient regained his consciousness fully, is it heart or brain?
Heart.
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 If the patient was confused after regaining his consciousness, still confused,
Brain.
brain. Okay. So if you find the patient in real practice in ER confused and stable, he's not talking, he's not doing anything, what do you think?
Brain problem.
Brain.
Post-ictal. Post-ictal. He has jerk movements, and the jerk movements, the seizures stopped. Easy until
Okay.
proven otherwise. Okay. So if you find the patient, his eyes closed or semi-closed or like that. He has secretions from his mouth and he is silent. Okay. So think about post-ictal until proven otherwise. Okay. So if the patient, um, for example, wet himself, is it heart or brain?
Brain.
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 If the patient has jerky movements, is it heart or brain?
Brain.
Brain.
If the jerky movements in hands only, it could be heart. If the jerky movements in all the body, it could be brain. Okay, what else? If the patient wet himself, is it heart or brain?
Brain.
Brain. Okay. So I want to think about pregnancy. Pregnancy, it could be ectopic pregnancy if the patient lost her consciousness, and most likely she will not regain consciousness until you stabilize here. So unlikely to find that in history. Okay. Maybe she has low anemia, low hemoglobin, sorry. Okay. I mean anemia. Okay. Most likely she will say past medical disease of anemia. So the patient is pregnant. How to catch the cause is pregnancy. Number one, the patient is pregnant. Maybe she's aware about pregnancy. She already known pregnant. Okay. And maybe low hemoglobin. Okay. So
Yes.
regarding pregnancy, maybe no jerky movements. Okay. Maybe she did not wet herself and uh, not matching heart, not matching brain. So you will think about low hemoglobin until proven otherwise. Okay. Diabetes mellitus, they will give you two actors. One of them he will answer, and then you will manage the patient, not the relative. So of course you will introduce yourself to both. You will make rapport to both. Okay, empathy to both, and then you will manage the patient himself or herself. Then you will continue talking to the patient. Okay. Regarding seizures, it could be first fit, it could be multiple fits. How to know that? From the question who approach. Okay. So when you ask the patient how many times in the past, if the patient said this is the first time, so it's a first fit. If the patient said it's a third time or fourth time, so multiple fits. Okay. Don't mention the diagnosis is first fit. First fit, it's not diagnosis. And no need to mention that in the beginning. One of the doctors, he said it's a first fit in the beginning. They told him misconduct. Of course, he doesn't mean why misconduct. He did not do anything. Patient said this is the first fit, and the doctor said so. The diagnosis first fit. He mentioned that in the beginning. I wonder why you mentioned that in the beginning, and I wonder why the Royal College say this is misconduct. Okay. So anyway, don't mention any diagnosis in the beginning. Okay. Try to mention in the end. Here, how to know this multiple fits with treatment or not? Of course, in past medical disease. If you ask him any past medical disease, he will say, I have epilepsy. So this patient has multiple fits and already known epileptic. Okay. If the patient said, I have past medical disease, you have to ask him the next question, any prescribed medicine? If he said no, it means he is neglecting himself. If he said yes, you should ask him, are you taking the medications as prescribed? Are you following instructions? Maybe he will say yes, maybe no. Okay. If no, so the patient not compliant. If he said yes, so the patient compliant, but the medications not effective. Maybe the dose, maybe the times. Okay. So he should review his treating physician. Okay. For you, if you find the patient, I'm talking about the decision now. If you find the patient has fall, the cause may be mechanical. What does it mean, mechanical? He slept. Okay, so this is mechanical. He slept, then he fell. Okay, maybe the cause is brain. If the patient said, I have headache, vision problem, any blah 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 before the fall, so it could be brain. It could be heart. If the patient said, I have heart racing, chest pain or discomfort before the fall, so it could be heart. It could be vision problem. Yes, if the patient said, I'm using glasses. Do you need to ask him, are you using glasses? No, no need to ask specific questions. You will not remember anyway. So he will say, I'm using glasses, but that day or that time, I did not wear the glasses. He will mention that. So no need to ask him. If he mentions that, it means the vision problem. Okay. Clear, guys, this point?
Yes, sir.
Yes. Yes.
Okay. So here, ask the same questions and he will give you the causes. Okay. If the patient has fall without injury, don't follow injury guidelines. Okay. I mean, he doesn't hit his head. I I will not use head injury guidelines. But if he said, yes, I fell down, I hit my head, here you should follow head injury guidelines. Okay. If he said, I hit my neck, I have neck pain, here you should follow neck injury. I mean Canadian spine rule. Clear? So fall only without any injury, no need to follow any guidelines. But he said fall with head injury, follow head injury guideline. He said fall plus neck injury, follow Canadian spine rule for neck injury. Okay. Regarding seizures, what is the management? So fall already, we know the decision because you will follow guidelines. Syncope, if heart, you will do complete physical examination, plus start by heart first and then brain, nerves, and back of the eye. If the problem is brain, start by brain, nerves, back of the eyes, then the heart. If the problem is pregnancy, so you will start by tummy ultrasound scan and then also you will do a full blood test examination also for the tummy, examination for the baby, examination for the brain, for the heart. Diabetes, once you give the patient dextrose, the patient will be okay. So already you know the diagnosis. Here, you can mention the diagnosis in the beginning. Yes, because you have evidence. You have evidence now. The examiner said the blood sugar is low. So the diagnosis is hypoglycemia, low blood sugar. But you don't know the reasons. So you can say, I need to take data to know the reason behind low blood sugar. Okay. What is the decision here? Observation 24 hours. So the cause could be liver, could be infection, could be thyroid. Okay. So seizures, if first fit or multiple fits, the decision is discharge. If the patient has no worrying symptoms, if the patient has no worrying signs. Okay. So worrying symptoms, he said, I am comfortable now, no weakness, no numbness, no vision problem, no headache, and nothing. The patient is okay now. He did not wet himself. He did not bite his tongue. Everything normal. So in examination, you can give him the likely decision. You can say, I will examine your brain nerves back of your eyes. If all are normal, I will discharge you with printed leaflet and refer you to vet clinic. Okay, so you will discharge to his GP, discharge letter, printed leaflet, and arrange appointment with Fitz Clinic. Okay. So fall, fall clinic. Fitz Clinic. Okay. Okay. So Muhammad, Omar,
Yes, Dr. A.
Yes. You have this station. You have 30 seconds and 6 minutes.
Okay. Can I start?
Okay, you can start.
Good morning. I'm Dr. Omar, Eid Registrar. May I know your name and age, please?
I'm Imran. I'm 65.
Nice to meet you, Mr. Amran. How can I help you?
Yeah, I fell down, doctor.
Okay, sorry to hear that. Are you comfortable? Do you have any pain now?
No, I'm okay now.
Okay. I need to take some data from you, Mr. Omar, regarding this phone. Is that okay with you?
Okay.
Okay. Can you tell me more about this phone?
Yeah, I fell down 2 days ago. I was in the farm and I did not see stones and I slept, then fell down.
Okay, this happened 2 days ago. You was in the farm and you slipped in stone and you hit your head. Is that okay? Who saw this event, Mr. Amran?
My wife,
And you told me it happened 2 days ago and in the farm. What do you think the reason you said to me you slipped in the stone, right?
I did not see
This
the
happened before.
stones and I slept, yes.
Yeah. How many times this happened before, Mr. Amran?
The
Or
first
this is the
time.
first time? Okay. Any headache or vision problem before the event, Mr. Amran?
No, no,
Any heart racing or chest pain before the event?
no, no,
Any cough or sneezing before you fall?
no,
Did it happen after standing?
no, no,
Did you bite your tongue?
no,
Did you wet yourself?
no,
Any jerky movement happen during the fall?
no.
Okay. And you told me you lost your conscience, right?
I did not say I lost my conscience.
Did you lose your conscience after fall?
Yeah, I hit my head and after that I lost my consciousness.
Yes. How did it take to recover?
Like 5 minutes.
5 minutes. Yes. Did you recover fully?
I was confused after that.
Yes. Any numbness or weakness after the fall?
No, no,
Any injuries?
no,
Any shortness of breath?
no,
Any temperature?
no,
Night sweat?
no,
Any change in your appetite or your weight?
no,
Any change in urine or bowel habit?
no.
Okay. Do you have any past medical disease, Mr. Amran? Any previous surgery?
No,
Any prescribed medication?
no,
Any disease run in your family?
no,
Any allergy?
no.
I will ask you some personal questions. Someone asked all patient, whom do you live with and where do you live?
My wife downtown.
What do you do for a living?
Pharma.
Do you smoke?
No,
Drink alcohol?
no,
By any chance use any illicit drugs?
no,
Do you want to add anything, Mr. Amran?
no.
What's your concern, Mr. Amran?
I have no concern, doctor. I'm okay now, but my wife, she asked me to visit ER.
Okay, Mr. Amran, according to your data, you have fall 2 days ago. You slipped in the farm because of stone, and you hit your head, and then after you lost your conscious for I think 5 minutes, and you remain some extent confused after the fall. So according to this data, we need to keep you in observation room, do complete physical examination, uh, do some blood tests, including heart function, including blood profile, picture screen, and we need also to do CT imaging to your head to exclude any internal injury.
Why you will
Uh,
do head imaging, doctor? I'm okay now.
you are okay now, but according to your age, more than 65, and you have post concussion, you have loss of conscious after fall, and you still to some extent confused after fall. We need to do head imaging to exclude any serious injury inside your head. If we find all the examination, investigation, and imaging of the head is okay, we'll discharge you with a printed leaflet discharge letter to your GP, and we'll refer to you to full clinic. If we find anything abnormal in any of the examination or investigation or inside the CT, we will involve the brain doctor. Is that okay with you? Do you understand?
Okay, thank you. Your time done.
Okay, thank you.
Okay, what is the indication? The patient has head injury or not?
Yes, head injury.
Yes, he head injury. Okay. So what is the indication to do head imaging within 1 hour?
GCS less than 13, dangerous mechanism to injury.
Unlikely in the exam because history taking, it means you will talk to the patient. It means his GCS is 15. So ignore GCS at all. Did you get my point?
Yes,
They will not give you patient GCS 13 to take history, right?
yes, yes.
So what is the indication now to do head imaging in head injury within 1 hour? What do you think, guys?
1 hour from the fall or from the attendance.
Of course, from the fall.
From the fall, he said it 2 days ago.
Yes, I'm talking in general now. What is the
In general,
indication
okay.
to do head imaging within 1 hour?
Mm.
If
Vomiting
vomiting,
episodes.
Vomiting, loss of
Number one,
conscious,
number
GCS,
one,
vacuum.
number
GCS,
one, jerky movements. Did this patient get any jerky movements?
No.
no,
No, deny. Loss of consciousness.
no,
Do you think is it indication?
No, not in the first hour.
Not in the first hour. Okay.
No.
So he went to consider loss of consciousness. So within 8 hours, if the patient has loss of consciousness or amnesia plus blah 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 plus what plus dangerous mechanism of injury or the age more than 65 or he has what else
Bleeding disorder.
bleeding
Using
disorder
uh,
declining the medication.
using
or
blood
using
trafficking.
anticoagulant, the new guidelines if he's using anticoagulant. Okay, so this patient is not using any prescribed medicines. Okay, and also what about his age?
More than 65. He's 65 already.
So here, if you find the patient more than 65 plus loss of consciousness, so he needs head imaging within 8 hours. Already the patient passed the 8 hours, so you can do head imaging now. Clear? So when you will ask for head imaging, inform the actor why you will do head imaging, right? It's not routine. Clear,
Okay.
Omar?
Yes, yes.
For example, he said, I'm using warfarin or using aspirin, any anticoagulant, then you can do head imaging. You will tell him because you are using blood thinning medication, for this reason, we need to do head imaging now. Clear?
Yes.
Okay. So if the patient has neurological deficits, I mean, if he said, I have numbness, weakness, anything like that, so you can do. If the patient said, I have problem in hearing, or I cannot smell, or I have problem in vision, so any problem in cranial nerve. How many cranial nerves?
12.
12.
12. 12 cranial nerves. Okay. Starting by the smell, number one, the eye, number two, three, four, number two, three, four, and six. Okay. So any problem in taste, any problem in hearing, any problem in vision, any problem in smell, so any problem in any cranial nerve, you should do head imaging. Clear?
Yes.
Patient has head injury and he has loss of uh, symptoms or signs relevant to cranial nerves, you should do head imaging within 1 hour. Okay. If the patient has jerky movements, of course. If the patient just is, yes, but this irrelevant to history taking. Okay. Well done. I will give you 9 out of 10. Thank you. Okay. Next one, Giovanna.
Yes,
Finally,
sir.
Dr. Hani,
Yes.
for this patient, this is the indication for CT already, more than 8 hours, and he's 65 and has history of loss conscious,
Yes.
right?
Yes. Yes. But
Okay.
you should mention why you will do CT. Okay.
Okay. Yeah, this is the Justin. Okay. But the other management plan is right.
Yes. So here you have clinical reasoning and decision making. Reasoning. What is the reason for this decision? Clear?
Okay.
So if you will say, for example, I will admit you for what? If the patient you did not explain, he will not accept, right?
Okay.
So I will do head imaging. Why? Because blah 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 blah. No need to let him to ask you. You should explain why you will do head
Mm.
imaging. Okay?
Yes.
Okay, so you can say, according to your data, you have blah blah blah. Now you are okay, and I'm happy to see that. But we have guidelines or we have policy in our hospital. Any patient has blah blah blah, we should do blah blah blah. Easy?
Yes. Yes.
Okay, thank you. Next one, Giovanna.
Yes, sir.
Yes, how are you?
I'm good, sir. Thank you.
So this patient collapse. Collapse here, it could be loss of consciousness, it could be dizziness, right?
Yes, sir.
So you will ask the first open question, then the second open question, then you will repeat the answer of second open question, then you will ask him, what do you mean by collapse? Okay? Is it loss of consciousness or dizziness? He will say loss of consciousness. Then you will use who approach. If the patient said dizziness, which approach?
Odipara.
Audible. Okay. So you have 30 seconds and 6 minutes.
Yes, sir. Good morning. I'm Dr. Jeevna, ED Register. May I know your name and age, please?
Nasser, 25.
Hi, Mr. Nasir. Nice to meet you. How can I help you today?
I collapsed today, doctor.
Oh, I'm so sorry about that. Are you comfortable? Do you have any pain?
I'm okay now.
I need to move you to the research room and hook to the monitor, check your vital signs to make sure that you're okay. Is that okay with you?
Yes.
I'm here to collect some data regarding your problem. Can you tell me more about that?
Yeah, I was watching TV in the living area and suddenly I collapsed.
So, Mr. Nasir, you said that you were watching TV and you suddenly had a collapse. Is that right?
Yes.
What do you mean collapse, Mr. Nazir? Is it giddiness or any loss of consciousness?
Yeah, I lost my consciousness. Yes.
Oh, I'm so sorry about that. Who was there with you at that time?
My wife,
When did it happen?
1 hour ago.
Okay. Why do you think the reason behind this?
I don't know.
Does this happen before, Mr. Nazir?
No, no,
Okay. Before the event, do you have any headache?
no,
Any vision problem?
no,
Any shortness of breath?
no,
Any chest pain?
no, no.
Any heart racing?
Yeah, I felt some heart racing, yeah, and just the discomfort.
I'm so sorry about that. Did it happen after prolonged standing?
No, I was lying down.
Okay. And do you have were you sneezing or coughing at the time?
No.
Okay. Do you have any tongue bite?
No.
Did you wet yourself?
No.
Do you have any jerky movements?
Yeah, in my hands.
I'm so sorry. And you said that you had a loss of consciousness, and how long it take you to recover?
I think it's 20 seconds, something like that.
Did you recover completely?
Yeah, I was okay, and no one helped me.
Okay. Did you injure yourself?
No.
Do you have any weakness or numbness in your limbs?
No.
Do you have any high temperature, night sweats?
No.
Any change in your weight? Any change in your appetite?
No.
Do you feel sick?
No.
Okay. Do you have any rashes in your body?
No.
Okay. Do you have any past medical diseases, Mr. Nazir?
No.
Any prescribed medications?
No.
Any previous surgeries?
No.
Any allergies?
No.
Any diseases runs in your family?
No.
Mr. Nazir, I'll be taking some more personal data, and these are the regular questions that we'll be asking for everyone. Where do you live and whom do you live? Whom do you live with?
My wife in downtown.
What do you do for living?
I'm studying.
Okay. Do you smoke?
No.
Do you drink alcohol?
No.
By any chance, do you take any illicit drugs?
No.
Would you like to add anything, Mr. Nazir?
No.
What is your concern?
I'm worried, doctor. What is the problem? Do I need any head imaging?
I appreciate your concern, Mr. Nazir. According to the data I've collected from you, the most likely problem could be in your heart. I'm so sorry to say about that. For that, I need to keep you in the research room and do a complete examination from head to toe. And I'll be doing some blood tests that includes full blood count, and we'll be doing heart tracing. Oh, I can see that in your heart tracing there are some changes, Mr. Nazir. I'm so sorry to say that you're having a condition in your heart. Medically, we call it as a Brugada syndrome. There is some STT coving in your anterior leads. For that, I need to keep you in the observation room itself and need admission. And we'll be taking a consultation from heart doctor. And we need to do a defibrillator treatment for you for that. Is my management plan okay with you, Mr. Nazir?
Okay.
Okay, thank you.
So,
Do you have
so
any
I,
more concerns?
I will stay here or I will go home.
You need to stay, Mr. Nazir. I'm so sorry to say that you have a heart problem, which we medically call it as a Brugada syndrome. For that, we need to take a heart doctor consultation, and you may also require some defibrillator treatment for that, because these are some abnormal electrical activities in your heart racing.
Okay,
You
so
understand? Yeah.
is this procedure serious?
Yeah, if we don't treat you, it could lead to a serious problem. So if you undergo this treatment, it will be okay for you.
What the heart doctor will do for me?
They will be doing some defibrillator treatment for you.
How?
Uh, they'll be taking into your
Thank
into the
you. Your
cath.
time done. Thank you.
Thank you, sir.
Insert a small device in the chest, which is called implantable
Defibrillator, right, sir.
cardioverter defibrillator. Okay?
Yes, sir.
ICD, implantable cardioverter defibrillator, to protect the heart from any irregular heartbeat. Easy?
Yes, sir. Okay.
You did well, but you should explain what the heart doctor will do, right?
Yeah,
Okay.
that will be doing in the car like cath lab, no, sir. So I thought that.
It's not our issue now. So here you can say, um, according to your data and according to your heart tracing, I'm sorry, heart tracing is showing syndrome, which is called in medical term Brugada syndrome. There is problem in the electrical activity in the sodium channels or in the channels in the heart, okay? More than enough.
Yes, sir.
And this, I'm sorry to say that it's serious. You should inform him because if you did not say serious, maybe he will refuse to be admitted, right?
Yes, sir. Yes.
So
Understood.
if you would tell him it's serious, he will take the decision seriously also, okay? But don't scare him. So just talk nicely and try to be low pressure of speech, low tone like that. I'm sorry to say that it's a serious problem. We should take this decision seriously. So I will call the heart doctor now. And of course, you finished examination, blood test, and blah, blah, blah. So I will talk about the heart doctor. He can protect your heart by inserting a small device in your chest, which is called implantable cardioverter defibrillator to protect the heart from any irregular heartbeat. Done. Easy?
Yes,
Okay.
sir.
I will give you 9 out of 10. Thank you.
Thank you.
Thank
Next
you, sir.
one, Kalyan,
Hello, sir.
how are you?
I'm good, sir. Thank you.
Okay, so this one collapse. Collapse here, it could be heart, it could be brain, it could be pregnancy. If you find female, okay, so you should think also about pregnancy, clear?
Clear, sir.
Okay, you have 30 seconds and 6 minutes.
Hello, I'm Dr. Kalyan, ED Registrar. May I know your name and age, please? How can I help you today?
Yeah, I collapsed too.
Oh, I'm sorry to hear that. Are you comfortable? Do you have any pain now?
It's okay.
I need to move you to resuscitation room, connect you to cardiac monitor, check your vital signs and blood sugar, and I will also need to do an ECG for you. Is that okay with you? I need to take some data from you regarding your problem. Is that okay with you? Can you tell me more about your problem?
Yeah, I was in the market and I was buying some vegetables and suddenly I collapsed.
You were in the you were in the market and you were buying vegetables and you suddenly collapsed. Is that right?
Yes.
Can you tell me what do you mean by collapse? Is it loss of consciousness or dizziness?
No, I lost consciousness.
Okay, I'm sorry to hear that. When did this happen?
1 hour ago.
Who saw the event? Any similar episodes in the past?
No, no,
A- Any idea, any reason why this happened?
I don't know.
Any headache or vision changes before the event?
No, no,
Any chest pain or heart racing before the event?
no,
Any cough or sneezing before the event?
no,
Did that happen after standing?
no, no,
Did you bite your tongue?
no,
Did you wet yourself?
no,
Any jerky moments?
no.
Uh, how long did it take to recover?
Like 20 seconds.
Did you recover fully?
Yes.
Any numbness or weakness in your body after the event?
No.
Any injury?
No.
Any shortness of breath?
No.
Any temperature?
No.
Any night sweats?
No.
Any change in weight or appetite?
No.
Any change in urine?
No.
Any change in bowel movement?
No.
Any vomiting?
No.
Any past medical disease?
No.
Any previous surgery?
No.
When was your last menstrual period?
5 months ago, I'm pregnant, doctor.
Okay. Uh, 5 months. Any prescribed medicines?
They are giving me medicine for hemoglobin.
Hemoglobin means low hemoglobin.
Yes.
Okay. Since how long you are using this medicine?
1 week.
Do you know the name of these medicines?
Something I cannot remember, but they said for iron, something like that.
Okay. Okay. Any allergies?
No.
Any disease run in your family?
No.
Where do you live and whom do you live with?
With my husband in downtown.
What do you do for a living?
I'm retired.
Do you smoke?
No.
And do you drink alcohol?
No.
Or by any chance, do you use any illicit drugs?
No.
Would you like to add anything regarding your problem?
No.
May I know what is your concern?
What is the problem, doctor? Do I need head imaging or anything in admission?
I appreciate your concern. According to your data, you lost consciousness 1 hour back and you regained your consciousness within seconds, within few seconds. And you told me that you are using medicines for low hemoglobin also. So the most likely cause for your loss of consciousness could be because of low hemoglobin. That means anemia. So to confirm this, I need to examine. I mean, I need to do complete examination from head to toe, including your tummy, heart, brain, and I will do blood test, including full blood count to check your hemoglobin. I'll do blood profile, inflammatory markers, infection screen, and electrolytes. And if there is any abnormality in examination or blood reports, if you have low hemoglobin, I will need to admit you under gynecologist, and you might need a blood transfusion for low hemoglobin. And if blood reports are normal, I will discharge blood reports, ECG, and examination are normal. I will discharge you with printed leaflet and return to your if there are any worrying symptoms, and I will arrange an appointment with a gynecologist. And I think you most likely don't need head imaging. Did you understand? Is the management plan okay with you? Do you have any other question? Sir.
Okay. Thank you, Kalyan. Your time finished 30 seconds ago. You did well.
Uh,
So
okay.
here the patient, it's obvious that heart problem, obvious not brain problem, right?
Yes, sir.
Here the patient mentioned clearly she's using medications for iron. Okay. So this patient needs admission or discharge. If the patient
Admissions.
collapse, most likely she needs admission. Okay.
Okay.
But you can give two possibilities also. If the hemoglobin is very low, so she needs blood transfusion. If the hemoglobin is borderline, she can continue with tablets, but she needs um, rest. I mean, she can stay at home if someone is supporting her, like her husband, anything like that. Easy.
Yes, sir.
So you can tell her if after examination, if we found your blood test very low hemoglobin, less than 6 milligram per dl, here we should uh, admit you under gynecology team. They can give you blood transfusion according to your blood group and cross match. If you found the hemoglobin is normal or borderline, here, even if you want to let the gynecology team take decision, no problem. Did you get my point?
Yes, sir.
So, in such a case, the gynecology team can take decision either to give you blood transfusion or to discharge you with printed leaflet, discharge letter to your GP. And in such a case, you should take rest at home, continue with treatment for iron and to improve your hemoglobin. And you can return if you have any worrying symptom. Easy?
Easy, sir.
Okay. I think you did well. I will give you 9 out of 10. Well done. Thank you.
Thank you, sir.
Next one, Ahmed.
Yes,
Muhammad,
Dr. Hani.
how are you?
Alhamdulillah, Dr. Hani. Alhamdulillah.
So this patient, she is female. You have two actors. Once you go inside the room, you will find two actors. So you will introduce yourself to both actors. Clear, Ahmed?
Yes, Doctor.
No nurse. You have only one examiner and two actors. So you will go inside the room. You will sit in front of both of them. You will introduce yourself. Good morning. I am blah, 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 one of the ED registrar. May I know your name and age? One of them will talk. For example, Mr. Sami will talk, okay? And Mrs. Karima, she's acting. She's closing her eyes and her neck to the right side or to the left side. Easy?
Yes, Doctor.
Mr. Sami will talk. He will say, uh, I'm Mr. Sami. This is Mrs. Karima. She is unconscious. I found her whatever anywhere. I called the ambulance. They brought her here. So thank him. Thank you. And nice to meet you. And I'm sorry. So rubber and the empathy. Sympathy. Easy.
Yes.
Nice to meet you. And I'm sorry that this happened to your colleague. Easy.
Yes.
Okay. Then you don't have nurse, act. Please, nurse, move the patient to resuscitation room, check vital signs and the blood sugar, insert to IV access. Clear?
Yes.
The examiner will say vital signs normal and the blood sugar blah blah blah. Or maybe he will focus on blood sugar. He will say the blood sugar 1 millimole. You will ask him if he said the blood sugar is 1, you will ask him millimole or milligram?
No.
It's a millimole, of course, right?
Yes, Doctor.
So if they said 20, for example, if they said 20 and silent, here you should ask him 20 millimole or milligram. Easy?
Mm.
Because
Yes.
20, if millimole, it's very high. If milligram, it's very low. But if he said 1, I don't care. 1 millimole or 1 milligram, both of them low. Easy?
Yes.
Okay, so if he said 1, it means very low. Okay. Here, You will ask the nurse, please nurse, give dextrose IV infusion 10%, 200 ml. Once you verbalize dextrose, the patient will act open eyes and be normal. Easy?
Yes.
You can start again. Good morning, I am blah 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 blah. One of the blah blah blah. May I know your name and age? She will say, I am blah blah blah, 25 years. Why I'm asking her again? If she answered, it means she is alert now. You cannot take data from anyone who is not alert, right? Okay.
Yes.
So the patient is alert now, and you can continue. Explain to her what happened. You came today, so you can say you came today unconscious because of low blood sugar. We gave you dextrose through your vein, through the cannula, and I need to take some data to know the diagnosis. No, already you mentioned the diagnosis. To know the reasons behind this low blood sugar. Easy?
Yes.
Okay. Then you can start your who approach. Easy?
Yes.
Okay. So before starting, you can ask here, are you okay? Are you comfortable now? Do you have any pain? As usual. Then you can start who approach. Okay?
Yes, doctor.
After who approach, you can ask the second part, then diagnosis and the management. In the end, you will repeat again. You came unconscious. The diagnosis again, mention again. You came unconscious with low blood pressure, low blood sugar. We gave you dextrose, and according to your data, the most likely problem of low blood sugar, it could be blah 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 blah. She will give you clue. For example, if you ask her any past medical disease, if she said thyroid disease, so what is the cause here?
Thyroid problem.
Thyroid disease means hyperactivity because you are burning glucose. Easy.
Mm.
Then,
Yes.
if you ask her any past medical disease, she said liver disease. What is the cause here?
Liver disease.
Liver disease. Okay. If she said I have malaria before, it could be malaria. I mean infection. Any infection burn glucose. Easy. Okay.
Mm.
If she said I have temperature, it means she has infection. Easy.
Yes.
If she said I have temperature for 3 days, you ask her any temperature in review of system. She said yes. So it means she has infection. Okay. Um, if you ask her, she said, for example, I have thyroid disease, liver disease, and these are the medication. Okay, I will review now. So the patient has two problem. Okay. What if she denied past medical disease and she said, for example, I have diabetes. So maybe she has one disease only, maybe three. In previous exam, she has diabetes, she has thyroid, she has liver. So what are the causes now?
Three causes.
Three causes: diabetes, thyroid,
Liver.
and liver disease. These are the causes of hypoglycemia. Easy?
Yes.
Okay. So diabetes, maybe she is using insulin without meal. Maybe she is using insulin high dose. So how to know that? When you ask her any past medical disease, yes, I have diabetes, I have thyroid, I have liver disease. Oh, sorry to hear that. Then any prescribed medicine? Yes, I'm using insulin, and this medicine, she will show you any medicine for thyroid, and this is for liver. Okay, I will review now. Then meal. The meal in prescribed medicine also. Anything through the vein, anything through the mouth, it will be where? In which point?
Prescribed medicine.
Prescribed medicine. So when you ask her any prescribed medicine, blah 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 blah. Okay, I will review now. Did you receive your meal today? If she said no, this is the reason also. If she said yes, ask her, are you using these medications as prescribed? If she said yes, so it's not overdose. Maybe she will say, I cannot remember. Maybe she will say, I used high dose of insulin. Easy. So
Yes.
the trick here in review of systems and past medical disease and the prescribed medicine. Easy?
Yes.
Okay, you have 30 seconds and 6 seconds. And the patient, of course, needs observation 24 hours, medical team.
Can I start?
You can start.
Good morning. I am Dr. Ahmed, ED Registrar. May I know your name and age, please?
I'm Sammy, and this is Mrs. Karima. She's unconscious. I brought her by ambulance.
Nice to meet you, Mr. Sami. And I am sorry that happened to Karima. I need to move her to resuscitation room and connect to monitor and check vital sign and RBS. Please, nurse, connect to monitor, insert to cannula and check RBS.
RBS is 1.
Okay. Please, nurse, give dextrose 2 milliliter,
10 millimole.
10 milliliter.
Sorry, 10%,
10%.
200 ml.
200 ml, 10%. Okay, given.
Yes.
Mrs. Karima, good morning. I am Dr. Ahmed, ED Registrar. They brought you to here with you were unconscious and we check your blood sugar. It was low. Are you comfortable now? And we gave you glucose. Are you comfortable now?
Yeah, I'm okay now.
Do you have any pain?
No.
I need to take some data from you regarding your low blood sugar. We need to know what the reason of this happened. Is it okay for you?
Uh-uh.
Can you tell me more? What happened?
Yeah, I was in factory and suddenly I collapsed.
So you told me you were in the factory and suddenly you collapse. Is it okay? Who saw the event about Mrs. Sami, Mr. Sami?
My colleagues,
When did it happen?
1 hour ago.
You said in the factory. Why you think the reason of this?
I don't know. You said low blood sugar.
Okay. How many times this happened before?
This is the first time.
Okay. What was you doing before the event?
I was sitting.
Before the event, any headache or vision changes?
No.
Any heart racing or chest pain?
No.
Any cough or sneezing before the event?
No.
Did that happen after standing?
No.
During the event, did you bite your tongue?
No.
Did you wet yourself?
No.
Any jerky movement?
No.
You lose your consciousness, as we see, and how long it take to recover?
1 hour.
Did you recover fully?
I'm okay now.
Okay. Any numbness?
No.
Any weakness?
No.
Any injury after the event?
No.
Any shortness of breath?
No.
Any temperature?
No.
Any night sweat?
No.
Any change in appetite or weight?
No.
Any change in urine?
No.
Any change in bowel habit?
No.
Any past medical disease?
No.
Any previous surgery?
No.
Any prescribed medicine?
No, no, no,
Any allergy?
no,
Any disease run in your family?
no.
Where do you live and with whom?
With my family downtown.
Do you smoke, drink alcohol, or by any chance do you use illicit drugs?
No, no.
What do you do for living?
I'm working in factory.
Would you like to add anything?
No.
What is your concern?
Is it serious, doctor? I feel I'm okay now. So I will go home or I will stay here or what?
I appreciate your concern, Mr. Karima. Can you tell me when was your last menstruation?
5 days ago.
Okay. According to your data, you were in the factory and loss of consciousness. They brought you to here, and we saw your blood sugar was low. We need to keep you in observation, you and admit you. We need to do full examination to do, including brain, back of your eyes, nerve, and do some test, including full count, infection screens, electrolytes, and inflammatory marker. There is no clear cause for you event. So we need to admit you under medical team. Is it okay for you?
Okay. Admit for how long,
Yeah.
doctor?
At least 24 hours.
Okay, thank you. Your time done.
Thank you.
Okay. Can you hear me clearly, guys?
Yes.
Yes.
Yes,
Okay.
doctor.
Okay. So this station, I try to deny everything. Of course, in the exams, they will give you something obvious, okay? But I try to make it difficult. So here, you did well. According to your data, you came with low blood sugar, you came unconscious, you regained your consciousness fully now, you are okay now after giving you dextrose in your veins. And at the moment, no clear cause behind this low blood sugar. You don't have any past medical disease, you don't have any problem at the moment. For this reason, we need to keep you in the hospital. We should admit you under medical team to do further assessment and management for at least 24 hours for observation. We need to check the liver, the thyroid gland, and what else? Pancreas. Okay. So here, maybe this patient has something wrong but not discovered yet. Okay. So after investigations, you will catch the problem. Okay.
Okay.
So you can mention differential diagnosis here. Yes. So you can say, because no clear cause. So you can say, we need to check the liver. We need to check any infection. We need to check the thyroid gland. Okay. Then you can mention what you can do. Complete full examination from head to toe. Examine your thyroid gland in the neck. Examine your tummy, liver, and spleen, and also pancreas. Then you will do some blood tests, including thyroid gland functions, liver functions, and also infection screen, inflammatory markers, and so on. Okay. Well done. I will give you 10 out of 10. Thank you, doctor.
Thank you, doctor.
Okay, next one, Basamat.
Yes, doctor.
Yes.
Dr. Hani, please, I have a question.
Yes, so
Sorry, about the patient female collapse with low hemoglobin level. You have indication for about hemoglobin level for admission or for discharge, a specific number?
yes. So if the patient in general, I'm not talking about this patient, I'm talking in general, any patient has massive blood loss, how to know massive blood loss? The heart rate more than 110, systolic blood pressure less than 90, the RR more than 30, this means the patient has massive blood loss. It means lost 2 liters or more. Okay, this patient
Yes.
don't check the hemoglobin. This patient, number one, blood transfusion. Number one, cross match means 4 units bagged RBCs. Okay,
Okay.
don't
Okay.
don't check the hemoglobin at all. Okay, I don't care
Yes.
about the hemoglobin. I mean, but if the patient
Okay.
is stable, he doesn't have massive blood loss. Okay, whatever traumatic or non-traumatic. The patient is
Yes.
stable. It means his heart rate less than 110, his RR less than 30, sorry. The systolic blood pressure more than 90. It means not massive blood loss. In such a case, you should check the hemoglobin. Easy.
Yes.
Hemoglobin, some sources say if less than 6, start blood transfusion. Some sources say if
Okay.
less than 7. Some sources say if less than 8. Anyway, you can mention any number. It will be accepted in the exam. So you can tell here, we will check your hemoglobin level. If less than 6, we can admit you under gynecology team. They can give you blood transfusion. Okay.
Yes.
And then discharge you if no worrying symptoms or signs. Easy.
Okay. Yes. Yes.
Then
Okay.
you can say if they found your hemoglobin normal, then they can discharge you and give you a printed leaflet to continue with your medications, current medications. But in such a case, you should take rest and we should be sure you are under supervision and under care, for example, your husband, like that. Clear?
Okay. Yes. Clear.
Yes.
Thank you.
Well done. Thank you. Okay, Basamat.
Yes, doctor.
Okay. So this patient has fits. So it could be first fit or it could be multiple fits. I don't care about first or multiple. Same. Clear?
Clear, yes.
So the same management plan. If the patient doesn't have numbness, weakness, no vision problem, no headache, no problem at the moment, then you can examine him. If you find no problem, then you can discharge him. Easy? And no
Yes.
need for imaging at all. But
Mm.
if the examination is normal, if the blood tests are normal, and so on, then give him another possibility. You can say, if unfortunately you have any problem in the examination, your brain, nerves, or the back of your eyes, or any problem in the blood result, then we can admit you and do head imaging as well for you. Clear?
Clear, yes.
Okay. You have 30 seconds and 6 minutes.
Good morning, I'm Dr. Basamat. I'm ED registrar. May I know your name and age, please?
I'm Kashif, I'm 25.
Nice to meet you, Mr. Kashif. How can I help you?
I got some jerky movements, doctor.
Sorry to hear that. I need to keep you in observation room, connect you to monitor, check your vital signs and blood sugar to make sure that you are okay. Are you comfortable now?
Yes,
Do you
yes.
need, do you need any painkiller or you have any pain?
No, no, I'm okay now.
Uh, I need to take some data from you. Can you tell me more about the jerky movement?
Yeah, I was in the college and I was standing with my friends. We were talking and suddenly I got jerky movements.
Okay, so you said you were in the college, then suddenly you get some jerky movement in the college. Who saw you during having this
My
jerky movement?
colleagues, my colleague,
And you said it was in the college. When did this happen?
1 hour ago.
Uh, do you know why this happens to you?
I don't know.
Is this the first time or it
First
happens to
time,
you?
first time.
Before having this jerky movement, did you have any headache,
No, no,
any neck or back rigidity,
no,
any visual problems?
no, no,
Did you have any chest pain or heart racing?
no,
Any cough or sneezing before that?
no, no.
You were standing, you said to me before.
Yeah, I was standing.
Okay. During this, did you lose your consciousness?
Yeah, yeah, I lost my consciousness.
It was all the jerky movement in all the limbs or one limb?
All the limbs.
There was some foam in your mouth.
Yes,
Did your eyes rolled up?
yes.
Any tongue bite?
No, no,
Did you wet yourself?
no.
How much time it takes you to recover?
5 minutes.
Did you recover fully or you were confused?
I was confused after that for 10 minutes.
Okay. Did you have any, did you feel sick?
No, no,
Did you throw up?
no,
Any bowel changes?
no,
Any change in the urine?
no,
Any trauma happened to you?
no, no,
Any weakness?
no,
Numbness?
no, no,
Any past medical history?
no, no,
Any past surgical history?
no,
Are you on any prescribed medications?
no,
Do you have any allergies?
no, no,
Any disease run in your family?
no.
I need to ask you some personal question. I'm asking for all my patients. Where do you live?
In downtown,
With whom?
my family,
What do you do for living?
studying.
Do you smoke?
No, no,
Do you drink alcohol?
no,
By any chance, do you use any illicit drugs?
no,
Do you want to add anything?
no.
What's your concern?
What is the problem, doctor? Is it serious? Do I need head imaging?
I appreciate your concern. According to your data, the most likely problem with you is with this jerky movement fix. This is the first time fix for you. So I need to keep you in observation room, do complete physical examination for you, including brain, nerves, and back of your eyes, your heart, and I will do check all vital signs and do some heart tracing for you. I will do some blood tests, including blood sugar, biochemistry, hematology, blood gases, and inflammatory marker, and toxicology screenings and electrolytes. If all examinations are normal, I will discharge you with a printed leaflet to your GP, and I will refer you for fit clinic. If there is any changes in your examination or blood test, maybe we will admit you or do some tracing for your brain or some imaging for your brain. Do you understand?
Yeah.
Do you accept my plan?
Okay.
Thank you.
Okay, thank you, Basamat. Your time is still 1 minute and 35 seconds. Excellent. So I think you covered all the approach. So accuracy, 100%, skillfulness, 100%, efficiency structure, organized, 100%, supportiveness, 100%, safety. Did you mention refer to FITS clinic?
Yes, I mentioned.
Okay. Did you mention discharge letter to GB and printed leaflet?
Yes.
Yes. Okay. So you should give two decisions. Start by the likely one. If the patient mentioned numbness or weakness or something worrying in the data, then we can do head imaging, right?
Yes, doctor.
Okay. So I will give you 10 out of 10. Well done. Thank you. So part one, then who approach, then part two. very easy approach. Then diagnosis and the management plan. Okay, next one. Asma,
No,
how are you?
fine. How are you, doctor?
Yes. I don't know if you are the one ask about breakfast.
Yes.
Yes, I'm not sure if the face-to-face course will be during Ramadan or Ramadan will be finished. But anyway, if any day within Ramadan, we did face-to-face course in Ramadan last year, and they were doing a special food for people who are fasting. Okay?
Okay, thank you.
Yeah, don't worry, we are arranging everything. Anyway, after the session, I will check the timing exactly. But I think it will be Eid. And
One day, I think, 1 day or 2 days in Ramadan will be.
okay, anyway, if Ramadan in the hotel, they will arrange everything, don't worry. So break and the breakfast as well. And we might finish before breakfast also. Okay?
Okay, thank you.
Yes. Okay, so this station, same also, same approach. Okay, the last one, the previous one was Basamat. We did one fit, okay, or the first fit, I mean. This time I will make multiple fits, and the patient has already epilepsy. So don't tell him about epilepsy in the beginning. So in the who approach, so part one. Then the who approach. When you ask him how many times in the past, he will say 4 or 5 times, for example. Okay. In past medical disease, any past medical disease, maybe he will say, yes, I have epilepsy. So this patient is non-epileptic. Then any prescribed medicine, he will say, yes, I'm using. Here you should ask him, are you following the instructions? Are you using these medicines as prescribed? Are you using same dose, same time? Clear?
Yes.
Okay. So accordingly, you will understand this is non-epileptic or not. You will understand his first fit or multiple fits. You will understand he's compliant with his medications or not. If he is compliant, maybe the dose is not effective. Maybe the timing not effective. Okay.
Okay.
So you have 30 seconds and 6 minutes.
Okay. Hello, this is Dr. Asma. I'm the ED physician for today. Can I confirm your name and age, please?
Asif 25.
Nice to meet you, Mr. Asif. Are you comfortable, right? How can I help you?
Yeah, I got some jerky moments today.
Sorry to hear that. Are you comfortable right now?
It's okay.
Okay. I need to move you to the resource area, so to observation area, and connect you to the monitor. And I need to collect some information regarding what happened with you today. Is that okay?
Yeah.
Okay. Can you tell me more about what happened with you today? About the pits?
Yeah, I was in the college and I was standing with my colleagues and suddenly I got some jerky moments.
Okay, so you were in the college, you're standing with your colleague, and suddenly you have fits. Is that right?
Yeah,
Okay. So when exactly that this happened to you?
1 hour ago.
Okay. Do you have any idea why that happened to you?
No.
Okay. Did that happen to you before?
Yeah, this is the fifth time within 1 month.
Okay, I'm sorry for that. So, what was you doing before that?
We were standing, talking, discussing.
Okay. Did you had any headache or neck stiffness, neck
No,
rigidity or
no,
vision changes?
no,
Okay. Did you had any heart racing or chest pain
no,
before the event?
No, no,
Okay. Was there any preceded by any cough or sneezing?
no, no.
Okay. Did you were you sitting and then stand suddenly and that happened to you?
No, we were standing.
Okay. Did you bite your tongue during the fits or the jerky movement that you had?
Yes, yes.
Okay. Did you? I'm sorry, that looks embarrassing a little bit, but did you wet yourself?
Yes.
Okay. And for how long do you have any idea for how long you've been having this jerky movement?
Like 5 minutes.
Okay. Did you lose your conscious completely?
Yes.
Okay. After that, did you regain your conscious fully?
I was confused after that.
For how long you have been confused?
Like 10 minutes.
Okay. Did you had any injury while
No,
you had this fit?
no,
The
no,
jerky movement? Okay. Was there any difficulty breathing?
no,
Okay. Did you notice any raise in your temperature or night sweating or
no.
change in your weight or okay. How was your appetite?
Yeah, I'm okay.
Okay. Did you notice any change in your water work or your bowel habit?
No,
Okay. Um, did you have any medical illnesses?
no.
You have?
Yeah, I have epilepsy
Okay. Since when?
4 years.
Okay, I understand that. Any surgical procedure before?
No, no,
Okay. Do you take any medications?
no, no,
Okay. Do you have any allergy to any medication?
no, no,
Okay. Is there any illnesses running in your family?
no.
Okay. What do you do for living?
Yeah, I'm studying.
Okay. I'm gonna ask you some private questions that we ask it to all patients, and all information will be confidential. Do you smoke or drink alcohol, or do you do drugs?
No, no.
Okay. So I'm gonna summarize what you have told me, that you are 25-year-old, you have been diagnosed with epilepsy, and you are not taking medication, and you have experienced today a jerky movement while you are standing with your colleague at university. It was involving you bite your tongue and you wet yourself, and it was about 5 minutes. Am I correct?
Yes.
Okay. Do you have anything else you would like to add?
No.
Okay. So from information you provided to me, I need to examine you fully, and that will include examining your I will do examine your head, examine your back of your eyes, and do heart racing to you. And also, I'll extract blood from you for investigation. I'm gonna do blood investigation, full blood count, urea, electrolyte, inflammatory markers. I'll check also your renal, your kidney function and your liver function. Also, um, I'll check your blood gases also if and after that I will have an idea what will
Thank
that
you.
be the cost.
Thank you. Your time done.
Okay, thank you.
Okay, what is your decision here?
He's not taking his medication. He's been diagnosed, but he's not on any antibiotic medication. If the examination is completely normal, so I'm gonna discharge him with safety netting and a letter for GB with referral, urgent referral to Fit Clinic.
Okay, thank you.
Okay.
So this patient compliant or non-compliant?
He's not on medication at all. But I didn't ask him if there is any medication prescribed, and he did
Okay.
not. No, I forget that.
So sometimes the patient is non-epileptic and is using medication. Sometimes he is not using medication. So you can explain to him what I understand from you. You are a non-epileptic patient, and unfortunately, you are not using any medication. So, if you finish your station, you can chat with him. Can you tell me why you are not using any medication? Clear? But it's not very important for the station. I mean, if you still have time, clear?
Yes, clear. So should not ask about medication if he prescribed or not, or he compliant or not?
No, I'm talking about why he is not using medication.
Oh.
This is additional. Okay.
Yes, I understand now.
Okay. So, of course, you will ask him about past medical disease, any previous surgery, any prescribed medicine. If he said, I'm not using medicine, okay, so any allergy, so once you give him the decision, then you can chat with him about why he is not using medicine. This is additional if you still have time. Okay.
Okay, thank you.
Well done. I will give you 10 out of 10. Well done. Thank you. Next
Hani,
one. Yes, please.
Hani,
Yes.
if the patient is not compliant with medication, is it considered indication for referral to medical team,
Why you will refer
or
to
I can
medical team?
discharge? I
Why
just
you will
asked.
refer to medical team? You have fit clinic. Fit clinic can do everything. You have only two options: emergency and the clinic. Clear?
Yes.
Emergency and the clinic. Is this patient emergency? Then you will refer to your team. Easy? So emergency
Yes.
means you will manage the patient and then refer to your team. If not emergency, clinic. Clear now?
Yes. Yes.
For example, the patient has fracture. This fracture is subtle. I'm talking about different station or different issue. Okay, the patient has
Okay.
subtle fracture. You are emergency physician. What you will do? Back slap, reduction, back slap, done. Then discharge the patient. Then refer to fracture clinic. Okay.
Fracture clinic.
If the
Yes.
patient serious, he has, for example, neurovascular bundle injury, or he's not moving any finger or anything. The patient has displaced um, uh, fracture. Then what you will do is splinting and refer to orthopedic now for ORIF.
Yes.
Clear? So you
Okay.
have only
Yes.
two
Okay.
options in any decision: clinic or admission. Easy?
Yes.
Okay. So this patient.
For this. Okay.
This patient, he has no numbness, no weakness, nothing. Okay, he has no problem. The patient is comfortable now and already non-epileptic or even not non-epileptic, but he has no worrying symptoms. If he has no worrying signs, then refer to clinic. Then, if the patient has worrying symptoms or signs, then you can do head imaging and admit with the
Medical.
relevant specialty. Clear?
Yes. If he asks me about driving, Dr. Hani, what I can explain to him?
Yes, if the patient asks you about driving, more than enough if you will tell him, I will give you printed leaflet. It will include advice regarding your driving. Clear?
Yes.
This more than enough because already in the printed leaflet, what does it mean printed leaflet? It means medications, advice, worrying symptoms, worrying sign. Clear? So
Yes.
printed leaflet include everything. Okay. Next one. I think Muzammil.
Assalamualaikum, sir.
Okay, I think this is the last station. Okay, we can do it again. Okay. So Muzammil and Emmanuel, you can do the same station again, but I will change. It will be multiple fits, and the patient is using medication, but not effective. Okay.
Yes, sir.
Okay, you have 30 seconds and 6 minutes. The same approach. You can start.
Just a minute.
Okay.
Yes, sir.
Okay, you can start.
Good morning. I'm Dr. Muzamil, the ED Register. May I know your name and age, please?
Asif, 25.
Nice to meet you, Mr. Asif. How can I help you today?
Yeah, I got jerky movements today, doctor.
Oh, I'm sorry to hear that. Are you comfortable now? Do you have any pain?
I'm okay now.
Okay. Mr. Asif, I will move you to the observation room, connect you to the monitor, check your vitals and sugars to be sure everything is okay with you. Is that right?
Okay.
Okay. Mr. Asif, can you tell me more about fits? Can you tell me more about your jerky movements? Sorry.
Yeah, I was in the college talking with my colleagues, and suddenly I got some jerky movements.
Okay. So, Mr. Asif, you were in the college with your friends and then suddenly you have jerky movements. Is that right?
Yes.
Okay. Mr. Asif, when did this happen?
1 hour ago.
Oh, sorry to hear that. And you were in the college. What do you think the reason behind this jerky movements? Okay. So, this has happened for the first time or this has happened previously also, Mr. Asif?
This is the fourth time now.
Oh, sorry to hear that. So, Mr. Asif, can you tell me, did you have any chest pain or heart racing before this event?
No, no,
Do you have any vision issues or headache
no, no,
before the event? No.
no,
Okay. Did you cough or sneeze just before this event?
no, no.
Okay. And did you lose consciousness?
Yes,
Okay. Did you bite your tongue?
yes,
Did you wet or soil yourself?
no, no.
So you bite your tongue. Are you in any pain? Are you comfortable?
It's okay.
Okay. Sorry to hear that. So can you tell me, do you have the frothing from the mouth?
No, no.
Okay. How much was the time you have this event?
Like 5 minutes.
Okay. And then you recovered fully?
No, I was confused for 10 minutes.
Okay. Sorry to hear that. Any numbness or weakness in your limbs?
No, no,
Did you hurt yourself apart from your tongue bite?
no,
Okay. Mr. Asif, do you have any breathing difficulty?
no,
And do you have any changes in your urine?
no,
Any changes in your bowel habits?
no,
Okay. Mr. Asif, do you have any past medical disease?
no,
Okay. A few more questions. Do you have any temperature?
no,
Any night sweats?
no,
Any loss of weight or loss of appetite?
no,
Okay. Do you have any previous surgeries?
no,
Any prescribed medications?
no,
Any past allergies or any allergies?
no, no.
Okay. Where do you live and with whom?
I'm living with my family in downtown.
Okay. What do you do for living, Mr. Asif?
Yeah, I'm studying.
Okay. Do you smoke, drink alcohol, or by any chance use any illicit drugs?
No,
Okay. Would you like to add anything?
no.
Okay. What is your concern, Mr. Asif?
What is the problem, doctor? Do I need head imaging or admission?
I really appreciate your concern, Mr. Asif. According to the data you have provided me, it looks like the jerky movements is called fits, and you have multiple fits before, so it could be an epilepsy. For this reason, I'll keep you in observation. Do complete examination from head to toe, including brain, nerve, back of the eye, and the heart. I'll do some blood tests, including inflammatory markers and infective screening, as well as heart racing and toxicology screening. If I find the examination abnormal or any blood reports abnormal, then I will do head imaging and treat accordingly. If I find everything is normal, the examination is normal, the lab reports are normal, then I will discharge you, give you a printed leaflet and discharge letter to your GP, and I will refer to the FITS clinic within 24 hours. Is that okay with you, Mr. Asif?
Okay.
Do you have any questions to ask?
So what if examination not good?
If the examination is not good, then I will do your head imaging.
Okay, thank you.
Thank you.
Okay, thank you, Muzammil. So you should give two possibilities, the likely possibilities and the unlikely possibility. Clear?
Yes, sorry, sir. I have a lot of disturbances with me.
Yes.
So I'm concentrating. Next time it will not happen.
Okay, inshallah. Okay, well done. I will give you 9 out of 10. So here, if everything normal, you can discharge with printed leaflet, discharge letter to GP, and the appointment with FITS clinic. If the patient has any problem in examination, then head imaging and manage accordingly. Because sometimes maybe the head imaging normal. Okay? So
Yes.
you will refer also to FITS clinic. Okay. Emmanuel?
Yes, sir.
Yes, you will do the same stations as the last one, last practice.
Yes.
Okay,
Sure.
so I will change. I will make for you multiple fits, and the patient is using medicines. He is following up with his treating physician, but unfortunately, no benefit.
Sure, sir.
Okay, you have 30 seconds and 6 minutes. You can start.
Good morning. I am Dr. Emmanuel. I am one of the ID registrars. May I know your name and age, please?
Asif, 25.
Nice to meet you, Mr. Asif. How can I help you today?
Yeah, I got some jerky movements, doctor.
Oh, I am so sorry to hear that. Are you comfortable right now?
Yes.
Do you have any pain?
No.
Okay. Do you still have jerky moments?
No.
Okay. Before proceeding further, I would like to connect you to the heart monitor and check your vital signs and blood sugars to be sure that you are okay. Is that okay, Mr. Asif?
No. It's okay.
Yeah. I need more information regarding your jerky moments. Can you please tell me more about your jerky moments?
I was in the living area watching TV with my wife, and suddenly I got jerky movements. I was lying in the couch.
Oh, I'm so sorry to hear that, Mr. Hafiz. You said like you are living in a living area and you suddenly sitting on a couch and you had these sudden episodes of jerky moments. Is that right?
Yes.
Yeah, I would like to ask you a few more questions to understand what's going on and how best I can help you, Mr. Asif. When was this event happened?
1 hour ago.
1 hour ago. Who has witnessed this event? Does anyone?
My wife.
Okay. You are sitting in your living room, right? What were you doing at the time of event? Okay. Did you had these episodes in the past?
Yes, this is the fifth time in this month.
Okay. I'm so sorry to hear that. Did you had this activity before also?
Yes.
Okay. Before the event, do you had experience any history of chest pain or heart racing?
No.
Any kind of headache or vision problem before the event?
No.
Okay. Before the event, do you had any cough or sneeze?
No.
Okay. You are sitting on a couch. Did you stand up immediately after that this incident had happened, or you are lying on the couch?
I was lying down.
Okay. After during this event, did you had any bite on your tongue?
Yes.
Oh, sorry to hear that. Did you wet your pants?
Yes.
Okay. Do you have any jerky moments during this time? Do you remember?
Yes.
Okay. After the event, did you notice any numbness or weakness in your body?
No.
Okay. After the event, did you notice any confusion?
Yeah, I was confused for 10 minutes.
Okay. After the event, did you lose any loss of consciousness? Did you lose any loss of consciousness?
Yeah, I lost my consciousness though.
Okay. How long did you lose your loss of consciousness?
5 minutes.
Okay. Did you recover fully? After that, you had a little bit of confusion, you said, right?
Yes.
Okay. Do you had any raise in body temperature?
No.
Any breathlessness?
No.
Any numbness or weakness in the body?
No.
Okay. Any change in the bowel habits?
No.
Any change in the weight?
No.
Any night sweats?
No.
Okay. I'd like to ask you a few more questions. Do you have any past medical history?
No.
Disease?
No. No.
Uh, do you have any surgeries earlier?
I have only epilepsy, doctor, but I don't have any medical disease apart of
Okay.
epilepsy.
You already known epilepsy. Are you on any prescribed medication for that?
Yes, the treating physician gave me anti-epileptic medicines. I think Tegretol, something like that.
Yeah. Are you taking regularly, Mr.
Yeah,
Asif?
yeah, I'm using them, doctor, but no benefit.
Oh, I'm so sorry to hear that. Do you any diseases running in your family?
No,
Any allergies?
no, no.
Okay. Where do you live and what do you do, Mr. Asif?
I'm studying.
Okay. By any chance, do you smoke or drink alcohol or use of any illicit drugs?
No, no,
Okay. Would you like to add anything else?
no, no.
Okay. Uh, what could be the reason behind that? Do you have any idea, Mr. Asif? Do you have any concern?
What is the problem, doctor? Do I need head imaging?
According to your provided information, you said that you are already known epileptic patient and you are on regular medication. Despite of using this medication, you are again having jerky moments. And definitely, yes, I would suggest you to keep you in observation room and do complete head-to-toe examination, including your brain, nerves, and back of eyes. And the good point is you are not having any warning signs like any related to other organs like heart, everything. So and I will do flu blood test as well, which includes complete blood picture, liver function test, and yeah, 12 lead ECG with kidney function test, inflammatory markers, and toxicology. Is that okay? Did you understand?
Okay.
Okay. Once all these reports are normal, I will discharge you with a medical prescription leaflet to your GP and give a referral to the fit clinic. And during this time, any my examination and any of the blood reports are abnormal. Definitely, I need you to do a brain imaging. Depending on that, I will give you the best treatment plan accordingly.
Okay, thank you, doctor. Thank you. Your time done 30 seconds ago. Okay,
Yes.
so this patient has multiple fits.
Yes,
If you
sir.
sleep 4 times or 5 times, you can say you have multiple fits 5 times this month. And according to your data, you have already known epilepsy disease and you are on prescribed medicine, anti-epileptic, anticonvulsant. But unfortunately, um, they are not controlling your fits. Okay. For this reason, I need to examine you from head to toe, your brain, nerves, and back of your eyes. If all are normal, okay, it means you don't need head imaging at the moment. Then I will do some blood tests, including inflammatory marker, infection screen, and electrolytes. Okay. Why you mention kidney function tests? Of course, you will do kidney function test. If you say some blood tests, it means all blood tests, right?
Yes, sir.
So, including, it means some of them, including blah, 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 blah. So, no need to mention kidney function test by name, okay?
Okay, sir.
Because irrelevant here, okay?
Yes, sir.
Of course, you will do liver function, kidney function, you will do everything, I know. But no need to mention by name, okay?
Sure, sir.
So you can say some routine blood test, including uh, infection screen, inflammatory markers, and you will do also the electrolytes. Okay.
Sure,
And
sir.
here, if you found everything normal, you can discharge with discharge letter, printed leaflet to GP, and appointment with FITS clinic. If you want to say within 24 hours, it's okay. It's not a big issue. So if you found any problem in examination in the brain, nerves, back of the eyes, in such a case, you should do head imaging, okay? Then
Yes,
if you
sir.
still have time, you can say uh, any problem in the blood test, like for example electrolyte, then we should admit you and correct the abnormalities. Easy.
Yes, sir.
This how to communicate step by step. So the most important points, then the least important points. Easy?
Yes, sir.
Okay. Otherwise, I think you are doing well. So I will give you 9 out of 10. You are doing well. Okay.
Sure, sir. Thank you, sir.
Thank you, guys. Okay. I think we finished today's session. Inshallah, next session. What do you think, guys? When and which topic?
Pediatric.
Yeah, sure.
Pediatric.
When?
Next
Wednesday.
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 Wednesday. So our schedule, Saturday, Monday, Wednesday, and we may do additional sessions on Friday. Maybe this week we will do Friday also because we have no time to
Yes, please.
Okay, guys?
Yes,
Yes, sir.
I have a question, doctor.
Yes, please.
In case of fall,
Yes.
we can ask in the beginning of the history to exclude head injury. Can we ask it, or neck injury, so we can stabilize the head first, or neck by using cervical collar, or we go by who approach?
No need. Here, once the patient will say fall, did they mention in the scenario head injury or neck injury? No.
No.
So no need to be overthinking, okay?
Okay.
If you find in the scenario, in the pie chart, head or neck injury, here you should apply neck collar in the beginning. Clear?
Okay. Thank you.
Yes. For example, different stations of neck examination, or they said assess cervical collar, and clear. Here you should apply. Easy?
Okay. So we will not ask in the beginning. So we'll go by how approach
Yes.
immediately, right?
Yes.
Okay. Thank you so much.
In the station, in the middle of the station, if the patient said, yes, I hit my head, also no need to apply neck collar. But in case in the middle of the station he said, I have neck pain, here you can say, oh, sorry to hear that. Let me apply neck collar for you now. But no need to apply, just verbalize. Okay?
Yeah. So it's not important in the beginning of the
No.
station.
No.
Okay. Thank you.
Okay. Any question, guys?
No, sir.
Okay, thank you, guys. Bye-bye. Bye-bye.
Goodbye.